So I've got Dr. Bilski here, and today we're going to be talking about Tylenol.
Tylenol, which is acetaminophen,
Okay.
and ibuprofen, which could be Advil, Motrin,
Right.
whatever. I don't know if you've seen, I think it was Super Bowl Sunday, there's a company now that's mixing the Advil, which would be ibuprofen, and Tylenol, acetaminophen, in one pill now.
Okay.
So just because I saw it, I have to go look into it. But we have a regimen for toothaches that we utilize. It's a combination and protocol alternating when you take ibuprofen and then acetaminophen, Advil, Tylenol. I wrote an article on alternative options for opioids. So say you're having an emergency toothache and you're calling me, and I think we used Super Bowl Sunday one night. I don't pick up the phone. There's nobody in the office. You can go to our website, but this is what you do. As an example.
Yep.
You wake up Monday morning, you're aching. You can't get a hold of us. We will be in the office by 7:30, but you might get a call and you can't get to us because you have something you have to do. So we'll say this: Dan, take 3 or 4 Advils at 8 a.m.
Okay.
Then at noon, take 2 extra strength Tylenol. Then at 4 p.m., take 3 or 4 Advils. Then at 8 p.m., take 2 extra strength Tylenol. Then at midnight, 4. The maximum daily dose that you can take in Advil, which is ibuprofen, is 3,200 milligrams.
Okay.
For acetaminophen, which is the Tylenol, extra strength, it is 4,000. So if you start at 8 o'clock with 4 of those Advils, that's 800 milligrams. So you're taking it 8 and 4 and midnight. That's only 3 rounds of 800 milligrams. That's 2,400 milligrams in the day. You haven't taken the other dose yet because you've been sleeping.
I'm sort of geeking out how you got all this math figured out, but that's great.
I'm a numbers person
I see
sometimes.
that. I see that.
And then the same thing with the Tylenol. So basically you alter your 4-2, 4-2, 4-2.
Okay.
You never get to it.
Right.
Because you're going to take a break, you're going to forget.
Right.
Advil works for about 8 hours. Tylenol works for about 4 hours, 6 hours, depending on how your body receives that. The critical factor that you have to know is if your body or your physician allows you to take the Advils, the ibuprofens, the ibuprofen works on inflammation.
Okay.
So that's 3. If you just want to work on the inflammation, that's 3 of those. If you want inflammation and pain reduction, that's 4. You have to take 4 of them.
Okay.
All right. If you only take the 2 Tylenols every 4 or 6 hours or 8 hours, you get 0 inflammatory healing. 0.
Gotcha.
It's pain relief.
Okay.
So the terms are anti-inflammatory and pain relief. 4 Advil. 3 for inflammation. If you want pain relief, it's 2 Tylenol. 2 Tylenol, no inflammatory response. That just doesn't happen.
Wow. That's fantastic. I don't think I've ever heard this before.
And then if you had a procedure and you're still having pain, so you had an emergency, you came in, we had to take the tooth out, you're going to have an inflammatory response from the extraction.
Right.
We may have to make an incision for drainage of the infection. It's going to hurt. Probably for about 24 to 48 hours. You use that same regimen to take care of the pain control and the inflammation. The study shows that works better than taking a Percocet or a Vicodin. That may sound shocking.
Right.
People my age that are used to always having painkillers given to us by our dentists or our doctors, that's reduced now. We are on a keep it down low on opioids.
Right.
It's a problem. So how we counteract that too, I had mentioned in another interview, Stella Life, which is an oral rinse that can be used as what's called a preemptive analgesia, meaning you use it before you come in to get your wisdom tooth taken out, or you know you're having a tooth that's going to come out. and then you utilize it throughout. That's another opioid alternative. So you don't take the opioid, you use the rinse, the spray, you do the regimen of the Advils and the Tylenols in combination, spread out over the course of a day.
Yeah.
And we're finding great results. In University of Indiana Dental School came out with a big paper on it. It's going to put a lot of people in check on what they're prescribing, and patients should know that it's healthier.
Yeah.
So,
that's fantastic.
Yeah, a lot of information there.
I mean, hopefully this gave our audience here a little insight on how to handle inflammation versus pain, and how to do it a little bit more responsible. So I'm sitting here, I'm still kind of geeked out. I'm thinking about your formula. We did put that drawing up there for you guys, so you can kind of see that visually. Hopefully that gives you a better sense of what to do. And always appreciate all your knowledge. I mean, you go way beyond just cleanings, right? And I know that would be an insult to say you're just doing cleanings, but I've known Dr. Bilski now for a couple of years at least, and I could just see the passion that you have for this, helping your patients.
Hey, we're real comfortable with what we do. Yeah, I'm passionate, a little geeky sometimes, dorky. And I think when you really consider what we're trying to accomplish here within our practice, just trying to help, trying to give you information.
Absolutely.
And clearly, I've given that lecture to my doctors that I teach, written a paper, an article on it, given a webinar on it. And there are still people that just are not going to do it, and even patients, which is important, that they just feel that that is not an adequate way to handle such stuff. But it's in the literature. You can Dr. Google it, and you'll find out that is exactly what you need to do.
Yeah.
So,
well, we hope this helped you guys out. Have a great day, and we'll catch you on our next video. Thank you.
Thanks for having me.